Hi friends. So today we are going to discuss about a very important middle ear pathology, which is the acute suppurative otitis media. It's also known as ASOM popularly. So ASOM is basically an acute inflammation of middle ear by pyogenic organisms, and it usually involves the middle ear cleft. For those who do not know the components of middle ear cleft, we have enlisted them below, and it includes the eustachian tube, the middle ear, attic antrum additus, and mastoid hair cells. Coming to the etiology, both viral as well as the bacterial agents are involved in the etiology of ASOM. The most common organism here is the viral, and this inflammation is usually superimposed by bacteria like Streptococcus pneumoniae or Haemophilus influenza, also Moraxella. It's common in infants and children of low socioeconomic groups. Coming to the route of spread, it spreads via either the eustachian tube, the external ear, or blood-borne route. Uh, Eustachian tube route is the most common route, and infection usually travels via the lumen of the tube or along the subepithelial peritubal lymphatics. Via the external ear, it might travel through traumatic perforations of TM, which causes an open route to the middle ear infections. It can be bloodborne in rare conditions. Coming to the predisposing factors, various predisposing factors are involved, like the upper respiratory tract infection, common cold, various exanthematous fevers like diphtheria, whooping cough, measles. There's also chronic rhinitis, sinusitis, which are predisposing factors. Infections of tonsils and adenoids, nasal allergy, tumors, as well as cleft palate are some extra predisposing factors. Coming to the pathogenesis, which is the most important thing to discuss over here, the pathogenesis of ASOM involves five stages, and we will eventually discuss all the stages in detail. Um, first of all, we'll discuss the stage of tubal occlusion, which is the stage of ET obstruction. So, basically, the pathogenesis involves five stages. As we just said, uh, it includes the stage of tubal occlusion, the stage of pre-suppuration, suppuration, and if the suppuration further resolves, it might progress to the stage of resolution. And if the resolution is poor, it can further evolve to the stage of complications, which we will discuss further. So, coming to the stage of tubal occlusion, this stage is characterized by eustachian tube obstruction. So there's basically edema and hyperemia of nasopharyngeal end of eustachian tube, which further leads to TM retraction. There'll be a retraction of tympanic membrane. Coming to the clinical features, the signs and symptoms, the patient will complain of blocked ear, hearing loss, and earache. Coming to the signs on examination, the tympanic membrane will be slightly retracted. The handle of malleus will assume a horizontal position, and there will be a prominence of lateral process of malleus. There will be a loss of light reflex on examination. Tuning fork test will reveal conductive deafness or conductive hearing loss, as you might all refer to. Further, coming to the stage of pre-suppuration, it can also be referred to as the stage of exudation or hyperemia. So I've basically mentioned all of these synonyms to pre-suppurative phase so that you can actually figure out the clinical features just by the names. that is the exudation and hyperemia. So there'll be a marked hyperemia of the tympanic membrane, and the TM will be congested and red. The middle ear will be filled with inflammatory exudates. Coming to symptoms, there'll be a throbbing earache and hearing loss and tinnitus in adults. As the children cannot verbally complain, we can look for symptoms like high degree of fever and restlessness in children. Coming to the signs, there'll be congested pars tensa, and the tympanic membrane will assume a typical cartwheel like appearance due to significant hyperemia, which is a very diagnostic sign of acute suppurative otitis media. The tuning fork test will again reveal the same finding, that is conductive deafness. Coming to the third stage now, that is the stage of suppuration. In this stage, the middle ear will be fluid filled with pus. So the pus will be present in middle ear as well as the mastoid air cells, which will eventually exert pressure on the tympanic membrane, which will lead to bulging and eventually might rupture the tympanic membrane. The symptoms include excruciating earache, there'll be a high degree of hearing loss, there'll be fever, which might be associated with convulsions and vomiting. The signs include redness and bulging of tympanic membrane. The handle of malleus will be undiscernible. Now, why will be the handle of malleus undiscernible? That's because the TM has bulged to such an extent that it appears as if it has engulfed the handle of malleus. And so, handle of malleus will be almost undiscernible on examination. And there'll be pus in external auditory canal. There will be pulsatile autoria from the TM rupture, which will resemble lighthouse sign. There will be a nipple sign, which will be significant at the site of the TM rupture. So it will be seen as a yellow spot at the site of TM rupture, which is known as the nipple sign. So both of these signs are very significant, the lighthouse sign and the nipple sign. There will be tenderness over the mastoid antrum, which is again a significant clinical sign. The investigations include X-ray of mastoid, as well as one can opt for CT of temporal bone, and both of these findings will reveal a clouding of air cells due to exudates. The management at this stage will be myringotomy. So basically, myringotomy involves taking an incision over the tympanic membrane to evacuate the pus in impending cases of rupture, especially when the drum is bulging and there is acute pain. When there's an incomplete resolution despite of antibiotic therapy, or it can also be preferred in cases of persistent effusion. So all of these are indications of myringotomy. Coming to the stage of resolution, the tympanic membrane rupture will eventually release the pus which was accumulated in the middle ear, and the symptoms will eventually subside. So all these stages will lead to resolving of the inflammation which is present. The symptoms include earache relief on pus evacuation. The signs which are significant include the blood-stained discharge in the external auditory canal, which later becomes mucopurulent. The tympanic membrane will have a significant small perforation of pars tensa in the antero-inferior quadrant. Coming to the stage of complications, if the patient's resistance is poor, to the treatment or antibiotics, or if the virulence is very high, the resolution will ultimately be poor. Okay, so it will lead to further complications like acute mastoiditis, abscess, facial paralysis, labyrinthitis, and various other intracranial complications like meningitis, brain abscess, etc. So you can see here, it's the list of complications. Uh, Coming to the treatment, we are going to just have a brief overview of the treatment. So the treatment includes systemic antibiotics, ampicillin and amoxicillin. We have mentioned the doses here: 50 mg per kg per day for ampicillin and 40 mg per kg per day for amox. The doses are mentioned here. Coming to other treatment modalities, we do have nasal decongestant drops like ephedrine. So basically, nasal decongestants, they relieve the ET edema as well as they promote the miliar ventilation. So it's very important in the treatment strategy. Coming to the other treatment options, we have oral nasal decongestants, we have analgesics and antipyretics, we do have oral toilet, whereas we do have dry local heat as well as myringotomy, which we just discussed earlier. It's done in cases of impending rupture and is an OPD procedure. So, myringotomy is a significant treatment choice and it's done in the stage of suppuration. So, this was about it. I hope you liked the lecture, small lecture. Thank you.